Ontario Premier Doug Ford, meanwhile, faced more questions today about a subject we were just discussing, long-term care homes, particularly whether there will be or should be a full public inquiry into what happened once this pandemic is over. Of the more than 1,700 COVID deaths in that province, more than 1,200 people came, or of those deaths occurred rather, in those facilities. 44 people in the province died in the SARS outbreak of 2003, and that led to a public inquiry. But Premier Ford today would not commit to one following this pandemic. Have a listen.
Well, what we want to do is make sure we get through this and support people in long-term care and right across this province. We're going to have reviews right across the board, no matter if it's a procurement system or if it's long-term care. We'll make sure we review it from top to bottom. We'll not spare a penny to make sure we correct the problem in the 176 homes that are infected out of the 626.
The Ontario NDP, during the session in the legislature today, was pressing the PC government for an inquiry. We've reached the party's leader, Andrea Horwath, now in Hamilton to find out more. Hi, Ms. Horwath. Good to see you.
Good to see you too, Vashi.
So I know that your party was asking very specifically for a public inquiry. We heard the response from the Premier there. He wants to do a review. He's committed to that. He's admitted that something like that needs to happen, but didn't seem to admit that a public inquiry was necessary. Why is it necessary from your perspective to have an inquiry versus a review?
Well, you know, a public inquiry is something that is completely independent, that is done with absolute transparency, and that is allowed to take whatever twists and turns are necessary to get to the bottom of what people need to know about what happened here in Ontario. Not only what's happened during this COVID crisis, but what left our care homes in such a terrible state that led to the horrific loss of life and just the brutal situation that family members and people living in long-term care have had to be going through for the last number of weeks. I mean, there needs to be a public inquiry. There's just no doubt that that's the best way, the nonpartisan way, and the most open way that we can actually look at what's going on. We can pull in the experts necessary, or the public inquiry can. They can listen to the voices of those folks who've been through this horrifying experience, and those folks who've seen the lack of quality care that has plagued our long-term care system for so long. They can talk to workers who contracted COVID-19 while they were working, and their representatives that have been dealing with these working conditions that PSWs particularly and others have faced in long-term care for far too long. A full public inquiry is the very least that Ontarians need to get to the bottom of this crisis that has been ongoing for decades.
So I spent part of the day reading through another inquiry that had been done on the periphery about long-term care, and that is the one into what Elizabeth Wettlaufer did. She, of course, confessed to murdering 8 seniors in nursing homes. And it's fascinating to read it in light of the pandemic, because so much of what is identified directly relates to everything that we're talking about right now. Staffing levels, how staff are working in more than one home, the pay, all of that kind of stuff is laid out very in bare bones, and the government was scheduled to respond to the recommendations by July. I again wonder, I mean, this was an inquiry. There's nothing that compels the government to act, no matter which political stripe is in office. Why is this, would another inquiry produce a different result? Is a review, perhaps, if the Premier is committed to it, the best way to hold this government accountable moving forward?
No, absolutely not, because as you know, this is a majority government, and there's nothing to compel the government to actually take a hard look and really look through every detail of long-term care. And we know already that the government hasn't looked at things and doesn't seem interested in looking at things like, for example, the role of private profits in our long-term care system. That's something that we have included specifically that needs to be looked at in long-term care. And certainly the Wettlaufer inquiry, and you're correct, did provide a number of recommendations. But even at that point, a couple of years ago, we were urging the Liberals to do the right thing and expand that public inquiry into a much broader scope. not just what was faulty that led to Ms. Wettlaufer to being able to hurt these patients and murder these residents rather in long-term care, but let's take a hard look at all the cracks, all the problems in long-term care, and the Liberals refuse to do that. This is why we need to have that full public inquiry this time around, because there are still pieces that have not been dealt with, that weren't dealt with by the Liberal public inquiry, that need to be dealt with so that we can once and for all not only get the recommended fixes for this, but make sure that they are implemented.
The federal leader of the NDP, Jagmeet Singh, is calling for an end to the privatization of these homes. Do you agree with that? Are you in support of that call?
In fact, we've been calling for the same thing for a very long time now, for years now. We have been saying we have to get the profits out of long-term care. If public dollars are being invested in the care of our loved ones, of our seniors, of our most vulnerable in long-term care each and every year, and they are, then those public dollars should be going to the quality of care for those people, the quality of work for those workers, the hours of work, the pay scales, the numbers of staff engaged at the home. It shouldn't be about making profits, and it shouldn't be about returns for shareholders. It should be all about using public money to properly invest in the quality of care of our seniors and loved ones. And so, yeah, I mean, Jagmeet is right on the money there. And certainly in Ontario, we have been calling for that for a very long time. And that's part of what we're asking for in terms of part of the scope of this public inquiry. Let's put that on the table. And because here in Ontario, the homes that were privately run have a much higher instance of outbreaks and of deaths than municipally run homes and then not-for-profit run homes.
The Financial Accountability Officer pointed out the deficit, of course, understandably, where the province is concerned, has exploded, just like it has on the federal scene. I heard, it's interesting, we've had many of these discussions on the show, and I heard from a couple of people who work for these for private companies that run these homes who said it's not fair to paint us, A, with all the same brush, and B, there are certain functions that we perform that the provincial government, rather, just didn't have the capacity to do in the past. Won't they be challenged to have the fiscal capacity to take on all these homes and operate them? Isn't that, I don't know, isn't that a big challenge in just sort of wiping the slate clean?
Well, Vashi, proactively, the Conservatives last time they were in office started us down this road towards massive privatization in long-term care. The Liberals followed along on that path while they were in government. It hasn't worked. And I mean, there's no doubt that not every home is the same, but what is absolutely clear is that profits get diverted, or public money gets diverted into profits. And where that public money could have been invested all along is in things like wages, quality of work for the workers, isolation protocols, making sure there's proper staff, all of the things that you talked about when you mentioned Justice Scalise's report on the Wettlaufer situation. Just because it's being done this way now doesn't mean it's always been done this way. It doesn't mean it's the right way to be doing things, obviously, considering what a dismal failure long-term care has been for many, many years in our province. And so, yes, there is definitely a big a deficit looming for the province of Ontario. But the bottom line is the sooner we get our economy back up and running and get people back to work, we'll be getting revenues back into the coffers that will help us to do the right thing. And the right thing is saving lives, making sure people have quality of care, not simply putting this stuff all under a rug and not acknowledging the fact that the municipally run homes and not-for-profit homes do a better job with a higher quality of care for our loved ones. And I would say that our loved ones deserve that quality of care, and everybody deserves to know that their loved ones are getting that quality of care, and that the people that we now call heroes are actually paid like heroes and treated like heroes and respected like heroes in the workplace. Should have been in the past, but not just during COVID-19, but into the future. And I think we do that by getting serious about getting the profits out of long-term care.
The federal government, I just had the Minister for Seniors on, and I asked whether or not there would be some sort of federal inquiry. I know you're asking for one at the provincial level, but there are calls for the federal government to intervene as well. Do you think there should be some kind of commission or formal investigation conducted by the federal government into the situation countrywide?
Well, I mean, it's something certainly to look at. There's no doubt that different provinces have have succeeded in some cases much better than Ontario, for example, and Quebec. There are different provinces that did things differently and ended up with different results. BC, for example, immediately started taking over homes that were in crisis and were running them publicly to try to get a handle on the spread of the virus. To this day in Ontario, Mr. Ford refuses to take that kind of action. In places like BC and Alberta and other locations, very early on, there was pay increases for those precarious workers to help keep them on the job and acknowledge the work that they were doing and the risk that they were putting themselves in. Not so in Ontario. In fact, to this very day, there isn't a single worker that's seen an augmentation of their pay.
There is a promise, to be fair, from the province.
I was just going to say, yeah, the premier, a good 6 weeks in, finally made the province, and here we are, the promise rather, and here we are 2 weeks after that, and still there has been no flow of extra pay for these workers. And there's a controversy, of course, around which workers are included and which have been excluded. So there's lots of questions to be asked here in Ontario, but nationwide as well.
Okay, I'll leave it there. Thank you so much, Ms. Horwath. Really appreciate you making the time for us this evening.
Thank you. My pleasure, Vashi. Take care.
That's Ontario NDP leader Andrea Horwath. The Ontario NDP is calling for a public inquiry into the situation at long-term or continuing care homes as they battle the COVID-19 pandemic. It's been less than a year, though, since the province held a similar kind of inquiry. That inquiry made key recommendations relating to nurse staffing levels and other issues around resident safety after nurse Elizabeth Wettlaufer confessed to murdering 8 residents of long-term care homes. Mark Zigler was a co-lead counselor in that inquiry. He joins us now from Toronto. Hi, Mr. Zigler. Good to see you. Thank you for making time for us.
Thank you, Vashi. Good afternoon.
Good afternoon. I wanted to start off, and I was thinking very much about this inquiry today as I was listening to the calls for another one in Ontario, wondering, as someone who was so sort of integral to the process, when you listen to the experience of people today, are there certain things that became apparent to you during the process of the inquiry that you think are relevant to the discussion that's being had at this moment?
Well, most certainly, Justice Scalise, in writing the report, was very sensitive to the vulnerabilities of the long-term care residents in the homes. She noted that the vulnerability wasn't just a function of their physical and mental state, but also there was a shortage of staff, particularly nurses, in helping to deal with them, and that the levels of government funding were particularly low. Were limited in terms of having the right staff or as many staff as are required. And she made a recommendation that the government look at staffing needs of homes and come up with a proposal by July 31 of 2020. Now, of course, no one knew there would be a pandemic, and everyone certainly feels for the families that have been affected by and lost loved ones in the COVID-19 pandemic. So certainly the thought of having proper staffing in these homes is foremost on the minds of anyone, whether it's a pandemic or whether it's a concern about the safety of residents because of someone inflicting harm on them in the homes. It's all about the safety of the residents.
The recommendation, I think, that you're referring to, and you can correct me if I'm wrong, was that the government conduct a study to determine adequate staffing levels on day, evening, and night shifts, and then, as you mentioned, report back by the end of July. Is that the right recommendation?
Correct, and there was a general recommendation that the government, within a year, in fact, they should implement a lot of recommendations immediately, and within a year report back to the public. Now, that was 9 months ago, and of course, a lot has happened since. But the report certainly looked at a lot of these issues, and what's obvious is whenever you have a stressor in the system, whether it's someone inflicting harm by injecting medication into residents, or whether it's a pandemic, the stressors can push the system close to, if not over the edge.
What is your sense, based on what you found and what you determined through the inquiry, of how understaffed these types of homes are?
Well, the commissioner didn't go into that level of detail because her mandate had to deal with inflicting harm and safety of residents, and there are many other issues that go into the proper staffing levels. She just noted that they were particularly low in terms of safety issues, and that the government should conduct a study with experts in that area without putting specific numbers on it.
I understand that the inquiry also found that it was difficult to get nurses to work in long-term care facilities. And in fact, what we've seen is that not necessarily nurses, but other staff work in more than one in order to make ends meet. What sort of factors made that difficult, and what was the recommendation to address it?
Well, there are also concerns about agency staff, people who weren't full-time workers but were brought in by agencies. And I think a lot of the concern is a lot of part-time work or funding for work, or in fact the financial incentives for working in public hospitals, which seem to be more favorable. So all of the recruiting and retaining of staff was something the commissioner referenced, and in her report she also dealt with recommendations to look at those areas. So in the context of what the commission was looking at, which was inflicting harm on residents, not a pandemic, a lot of these things made a lot of sense, but they extend well beyond the issue of inflicting harm on residents.
Some of the conclusions being drawn are similar, but the context is obviously very different. Do you think the inquiry, for example, that we're hearing from the NDP that they are asking of the government to conduct, do you think it would be a useful exercise in this instance?
Yeah, I can't really comment on that. I don't know that it's appropriate. It's essentially a political issue. I think what I can say is that there are issues outstanding from Justice Scalise's report from last July that will address some of these issues, but it's a much broader picture and it's a political issue, not a legal one.
Do you think, I guess, what is your sense of the degree to which the public is seized with this versus at the conclusion of your report or your inquiry? I think obviously there's a keen interest in what happened at the time, but at this point, everybody seems to know somebody who's affected by it, and people are sort of sitting back, at least from the feedback I get, saying, wow, we had no idea it was this bad.
Yes, well, I think people had an idea that there were problems in long-term care when this report came out, and there are many reports before this report that go back a couple of decades. So it's not quite that clear cut. I think we all know people in long-term care. People have always been aware of stresses in that system, and it takes, unfortunately, if it takes a pandemic to again put this in the public eye, my heart goes out to all the families who've lost loved ones in this context. It's sad that it has to be that sort of thing that brings the issue to the fore. How the government deals with it is an issue, of course, of the government.
That it is. All right. Thank you, Mr. Zigler. I appreciate your time and your insights this evening.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.